Thank you for allowing me to present on an item, and I do have witnesses in support on valley fever. And I know, Mr. Chairman, you're very keenly aware of the issues that occur not only in the valley, and I think I've spoken to every member on the committee already about the severity that valley fever has throughout the entire state. We know that there are reported cases in 50 out of the 58 counties. We know that CDC says, according to their estimates, that there's 150,000 cases every year that don't even go reported. Individuals that do have valley fever, there's 60% of those that don't even know that they have it. And so, Mr. Chairman, as we go through the budget process, one of the things that we were always struck with was, how do we combat this issue? How do we make a difference for these families that are suffering? And one of that ways is to not only show the need, but also to address it with the resources to help tackle this issue. And so before you, we have a budget request to help do that. And that's divided up into several areas. One of those areas is in research, because we know that there is no cure and there is no vaccine for valley fever currently as it stands today. There are efforts underway to help do that. In fact, the University of California has taken some of those research efforts already. We'd like to help them because that funding is dried up now as well. And also public awareness. You know, when we're talking to each of our counties, and I've been talking to counties up and down the entire state, it's letting people know that if they could catch this early, it means a world of difference for their health moving forward. If they could catch it early, you know, maybe they don't spend the rest of their adult working life on disability, right? A lot of the workers and the families that I've talked to that have been affected have said, we want to work and we want to do things and we want to be productive. And I wish somebody would have told me, or I wish I would have known to be tested early so that hopefully we could have done something about this. I know I've spoken to each of you guys also about several members of the legislature that have been touched by valley fever directly. And so it's a silent epidemic with the numbers that we've seen increasing just last year. And so with that, you know, I respectfully ask for the resources to combat valley fever. You know, down in Kern County, at Kern Medical Center, and that's one of the folks that will testify, is we have an additional ask. Myself, Senator Fuller, and Assemblymember Fong have asked for additional resources to go towards the Valley Fever Institute, and I'll let them talk a little bit more about that as well. But as we move forward, it would really behoove us to do something for these families, and I really appreciate each of you taking the time to personally talk about some of those issues and to talk about how this has affected some of those families.